All right. Good morning, everybody. Really appreciate you taking the time out of your Thursday to join us. We have Mr. Raymond Mott with Wellabe. I'm not going to talk past this point, but Ray is, and he is going to give you all the reasons that you should be selling Wellabe, how easy it can be, and how much it can increase your overall income while shoring up your Medicare business. So, Ray, I'm going to give it to you, sir, and you just let me know what I can do for you.
Well, thank you so much. I appreciate it, Courtney. Well, guys, I want to say first and foremost, hello. Glad you're on the call. And my goal on this call today is to virtually answer questions that you may have in your head. And the number one question typically I say that most agents have is, why should I be selling Wellabe? What makes you guys different? So my goal today is to answer that question, why Wellabe? And I'm going to give you the reasons why. And please forgive me, this says Tuesday talk. It's not Tuesday. Today is Thursday, but I just changed the date because we had a Tuesday talk a while back that covered, as everybody else refers to it, as ancillary products. Well, I'm changing that name. It's no longer going to be referred to as ancillary. I'm going to refer to it as necessary plans. Necessary plans means that when you're typically doing business with your clients out there, you know, and I know they have a lot of out-of-pocket expenses, gaps, holes, whatever you want to call it. Bottom line is these are necessary plans. These are the things that are going to make them keep their money in their pocket if they use it. Just a little bit about me, guys. I've been with Wellabe a little over 3 years now. I've joined the corporate side. I came from the field. I've been in the industry. Hate to tell you this, but the first Medicare supplement I ever wrote after I got my license was January 1984. So I've been around a couple of days and I know a little bit about a lot of stuff, but not going to claim to be an expert. Okay. So let's go ahead and kick this off. Thank you for joining us, and I'm strap in and take notes and be prepared to ask questions at the end. But why Wellabe? Why Wellabe's products? Well, first and foremost, we get a lot of feedback from the field, and they love the fact that we have digital first focus that simplifies us doing business with you and vice versa. We have a lot of tools that makes it easy to close the sales out there. The number one actual compliment that we get from the field is they say, you guys make it so easy to do business with, and we love doing business with Wellabe. And now for some of you guys that may be new to Wellabe or new to the industry, Wellabe might not be a household name so-called yet. We were known more as a Medico, but we made a brand change in June of 2023 is where Wellabe actually purchased all the companies that previously the owner of Medico owned, which was American Enterprise Group. And now it's Wellabe, but underwritten by Medico. And to explain that relationship, they're not two different companies. We're one company. But to make it easy, as I tell everybody, Wellabe would be like Coca-Cola and Medico would be like Coke Zero. It's the brand within the brand. Okay. But ancillary products that win over the competition, like I said, I didn't change it on this screen because I haven't gotten it approved yet, but I'm going to refer to ancillary as necessary plans. Customers find flexibility, value, and commitment when you're looking at our portfolio and what we can do for them. When to cross-sell. A lot of agents out there that are doing Medicare Advantage or Medicare or MAPD plans or whatever, they're doing it during AEP predominantly. And obviously, sometimes they, it kind of gets a little uncomfortable to stop what you're doing to start talking about why it's important that you should add a necessary plan called hospital indemnity. So some people wait till they go back or, other part times of the year that they can go. But the good news is you can sell hospital indemnity year round. It is on the scope of appointments. And actually, I would tell you, do not leave during an appointment for an AEP or OEP or whenever without talking about it because it's so very important. And I'm going to share some reasons why. But you can do this obviously during OEP. You can reach out mid-year and ask about any changes in their lifestyle, any big events that happen, maybe a birthday, asking people that was there any additions to a family, anything. but you can contact your current clients about Wellabe's reward program, then follow up and ask about new coverages needed. And I'll cover briefly about what our Wellabe rewards program is well. If you haven't heard about it, it's our program that it's our way of giving back to customers, saying thank you for being a loyal customer. Wellabe Rewards, virtually they earn points by as many policies as they have. We give them more points for if they add policies. The length of time they've been with us, we give them points. And you say, okay, well, what are they doing with these points? Well, they can use them for a variety of ways. They can use it to get gift cards. For example, one of the hottest things in the beginning when we started this was the Instacart. They can use their points to get Instacart online grocery shopping that's delivered to their doorstep. They can redeem them for certain types of gift cards. We also have people ask, well, Raymond, do you guys, some of these companies have silver sneakers. Do you all have that? No, we don't. We have Active and Fit, which is similar to silver sneakers, but it allows them and will help pay for memberships to like YMCA and stuff like that. We do a lot of educational videos and articles that if your customer logs into the customer portal, they can actually read them, watch the videos, and they get points for that as well. It also has things about Weight Watchers and helping controlling your diet and exercise. It has Duolingo and things like that they can keep their mind sharp. But all of these different things that they have access to, they can earn points. Plus, we're giving like Walgreens and CVS big discounts there. We have over 95 retailers that we're giving discounts to. And there's just a multitude of things. I'm not going to sit here and name every one of them, but I would encourage you to look it up on the site and learn more. Plus, you could use it in your presentations when giving your clients another reason why they should look at Wellabe because of what all the things we do at no additional cost for them. But the biggest one I want to share with you guys is hospital indemnity insurance. And I want to say indemnity because it's not a reimbursement. This is going to pay whatever the benefit says it is on the policy, and it's going to pay it directly to the client if they file the claim with us. And I'm going to get back to that as well. But as you can see here, we're available in 28 states, and you got two shades of red. I call it a dark red and maybe like a pink, a shade of pink, maybe. I don't know. But anyhow, when you have a policy with Wellabe, let's say you've, because we came out with this new enhanced hospital indemnity October 1st of last year. And a lot of agents initially said, well, gosh, this one's so much better than the other one. How about if I just go out and rewrite my client under this new plan? And that's an absolute no-no. You don't want to do that. You can really penalize your customer if you did that. So what we do is we encourage you, there's a dedicated number, it's a customer service number that you will call to be able to make changes to their plan. And let me tell you the big advantages of it is you have the ability to increase the benefits on their existing hospital indemnity with a phone call. And by doing that, let's say their hospital indemnity is 4 years old. Well, if you went out and seen them today, they're going to be 4 years older, right? Well, if you're doing adjustments internally to the plan, they're going to get paid for adjustments. For example, let's say you had them on a $300 a day benefit and you want to take them to a $500 a day benefit. We will allow you to do that, and you'll charge them the price of the issued age when they first bought their hospital indemnity. So they're not going to be paying 4 years older, if the policy is 4 years older now. Now, if you, and you can do that with even including increasing their current riders, you can do that. Now, if it's a state where you want to, or any state that you want to add a rider that they don't have, now the new rider you'll be adding to their plan will be charged at their current age, And there's two things you need to be aware of. We'll let you make changes internally to the plan, meaning adjust the benefits on what they're having currently once a year. But if you're going to add a rider or to take away a rider, you're going to only be able to do that once in the lifetime of the policy. Okay, so that's the thing. And we have a flyer that talks about post issue, and I will actually send it to you guys after the presentation. I'll send it to you, Courtney, and you can distribute it to everyone. The biggest thing, why Wellabe, why our hospital indemnity? Because we know you have a lot of choices. Well, the biggest thing is we write from ages 18 to 85, and then we have the largest guaranteed issue window in the industry. Ages 60 to 79, it's guaranteed issue. No health questions. The only thing is you got a 6-month pre-ex, but you have a 6-month pre-ex even on the underwritten side. And virtually the way it works is anything you were treated for 6 months prior to the application effective date. So let's say that this person took effect January 1st, 2026, then anything they were treated for 6 months prior to January 26th, those conditions would have a 6-month pre-existing condition clause, which they would start being covered after July 1st of 2026. Okay. We also have a 7% discount on households. Virtually, that means if the person you're writing a hospital indemnity on has someone that lives with them that's at least 18 years of age or older, then that person that's buying this plan will get a 7% discount. Some people ask, well, what if that other person wants to get a hospital indemnity? They sure can get it, and they can get a 7% discount because both people are living together. Okay. Cross-selling. When we talk about cross-selling Medicare Advantage, obviously you can do it with a number of different plans, but most people are doing it with MA plans, MAPD plans, high deductible Med Supp. And what's really cool about our platform now is if you're writing a high deductible plan F or a high deductible plan G with us, there's going to be a bubble or a little thing that you can check. And it's virtually the question is going to ask you, would you like to add a hospital indemnity to this high deductible Med Supp? By clicking the bubble, it'll automatically add it. That simple, and it'll pre-fill out the app for you, and you'll just have to charge them the price for it. And but it's really, really cool. And I'll show you some things because I'm going to demonstrate how to do that on the Easy Match presentation. But my Easy Match is the tool we came out with this. We started it in October 1st of last year, and it's to quickly create a quote, but also easily to complete the sale. A lot of people say that the reason why I'm not selling hospital indemnity is because I'm just not confident enough to do it. I don't know what words to say. I don't even know what I should be putting together for the customer based on their out of pocket. Well, you're in luck. If you're that person I just mentioned, you're in luck because you're going to learn today very, very soon, and it's going to make your life so much easier, and you're going to make a ton of money doing it. But the Wellabe tools and resources that we have, even if you're an agent that maybe still goes out and sit with them at their kitchen tables, or if you're having customers come into your office and you're using a legal pad to draw things out or write things out for them, we actually have a comparison sheet, a hospital indemnity comparison sheet where you can list it's kind of the My Easy Match tool, but it's on paper. But we've been having this a long time, but you can actually list out their benefits of whatever they have. And then to the right of that, you'll be able to put in whatever you recommend to cover those out-of-pocket expenses. So we have that. It's on the agent portal. If you're using any type of needs assessment, it's a great idea. If you're not doing any fact finding, I would give you some advice you may want to start, because when you start doing a fact finder or a needs analysis with your customers, it really opens up a lot of doors and a lot of things that you're triggering them to have conversations about. I highly recommend doing that, and especially if you want to be a full service agent. Because let me tell you right now, you can learn the easy way or you can learn the hard way. The easy way is you start doing it no matter if it's uncomfortable or not, asking questions about their other plans that they may have. But more importantly, the hard way is if you're not doing it, the hard way you'll learn is when somebody else comes behind you that does a needs analysis and says, well, my other agent didn't tell me anything about this. They never asked me questions like this. So that's the hard way to find out, is because somebody else is going to do it. And it could put your business at jeopardy if you're not, because you want to be known as an agent that can take care of more than one thing for them. But marketing materials, we have new social media toolkit. We have postcards that you can use. So it's very important that you know what's on the agent portal at your fingertips that you can use. My Easy Match, like I said, I'm going to do a demonstration on this at the end, but it's a real easy tool. When you get into the quick quoting tool and you click on hospital indemnity, you're going to put in the state that you're wanting to quote it in. You're going to put in a zip code. It's going to ask you a male or female, date of birth. And then as soon as it opens up, you'll be able to, one of the first questions it'll ask you is, do they live with another person at least 18 years of age? It's going to ask you what county does this person live in? And the reason why we're asking these questions is because My Easy Match already has all the MAPD plans or MA plans out there, and we can find them using this tool by simply getting their address, their county, and then choosing the plan, whatever plan they have. And I'll demonstrate that for you. But obviously, if you want to dive deeper into it, you can look at our demo videos, and we also have a user guide how to use the My Enroller tool, and I can send that for you, send you to you as well, Courtney. Critical illness, another one of our ancillary / needs necessity plans, is our critical illness. In some states, we still have our first diagnosis cancer, but if you don't have the first diagnosis cancer, you probably have the critical illness. This is a new product for us that we came out with in August of last year. And as you can see here, if most of you on the call is from Tennessee, this has replaced our first diagnosis cancer, and you can write this. It's called critical illness, but I like to refer to it as our cancer, heart attack, stroke policy, because it does more than just cancer. It's available now in 21 states. That will be increasing. We will be adding some more. And it covers cancer, heart attack, and stroke. You can get it as a cancer only plan if you want. You can get it as a heart attack and stroke policy if you want, or you can combine them to get both. We write this product from ages 18 to 89. It does have a 6-month pre-existing condition clause in it. And that may vary by state, because I think the state of North Carolina, the way their insurance department works is if you sell a product in their state, they don't want to have any pre-existing. So I think North Carolina, there's no pre-existing in that state. And then there's a 30-day waiting period. Most cancer policies or dreaded disease type policies, or in this case, critical illness, you can't use it the first 30 days that it's in force. Cross-selling it, obviously, cancer is a big thing. It's more and more prevalent in today's world, especially in the Medicare Advantage world. It is one of the fastest things. If you have a hospital stay or if you have a cancer diagnosis, that is the 2 fastest things that's going to make you hit your maximum out of pocket on your Medicare Advantage plan. And you definitely need to talk about this with your clients. Ask them if they have a cancer plan in place. Even if they do, if they wanted something more that covered more stuff, like instead of just cancer, they can get the plan that covers everything on there. And you can have this in addition to another cancer plan. You can have this in addition to the hospital indemnity with our lump sum cancer rider on it. But we pay 100% of the benefit to the spouse or the partner, because this is written like you can write it on a couple on the same app. And whatever they get, they have a children, you can add the children and they get 25% of the benefit. You can write this product for as little as $5,000 lump sum benefit all the way up to $100,000. And some people say, well, we really liked your first diagnosis cancer. Well, if you like that one, you'll love this one. Another big selling point about our critical illness is our look back period on underwriting is only 5 years. Most of your critical illness plans are 10-year look back. So that's very, very important as well. But there again, by using a need assessment form, could open up a lot of clients for you as far as additional sales simply by asking the right questions. But we have marketing materials, videos, postcards, social media and toolkits coming the second quarter of this year on that. So be ready to learn more about that. Another reason why you want to sell our critical illness is we have it. This is the only product right now we have an incentive going on. And this started January 23rd of this year. And virtually it's real easy. We will pay you $50 per application, starting with your very first application. And you can do this, and we're going to continue this through the end of March. So if you just got a wild hair and you just started writing, let's say you wrote 100 critical illness applications and got them issued, you would get $50 for each one of those. So you'd get an incentive for $5,000. It's just extra money just for you doing your job. Our short-term care product. A lot of people get confused with the terminology of short-term care. They think, is this that short-term medical insurance that people buy but when they're between jobs? No, ma'am. No, sir. It is not. This is like a plan that covers convalescent care, home health care. So if a person, typically when they go to the hospital and they need some after leaving the hospital, like when they go into a skilled nursing facility or whatever, or if they have the ability to go home to get care, that's what 99% of people want to do. I would rather be treated at home, and statistics show that they will heal quicker and get back to their normal lifestyle quicker at home than in a facility. But anyhow, we write this product from ages 40 to 89, and it was designed to be a home health care product first. And you can add facility-based care like nursing home or assisted living as a rider on this plan. It's very simplified underwriting. It's very liberal. We have 11 health questions, but it's broken down into three parts. We have three levels of care. We have a limited benefit rider for those people that need a almost guaranteed issue plan. It only has one knockout question for that. And that question asks, are you currently receiving care? Like, are you currently receiving care for home health and stuff like that? If they can say no to that, at least they can qualify for that at the very least. But there's a catch. In order for one person to get that plan, someone else in the household must qualify for one of the other two plans, the better ones. So we use the limited benefit to overcome the objection of, if you ever written a couple before and one of them got issued and the other one didn't, and they got upset and they said, oh, well, if you can't insure my spouse, I don't want it either. That was pertaining to like long-term care. Well, this short-term care plan, the reason why it's more popular than long-term care is because the two reasons why people are not buying long-term care, it's too expensive and it's very hard to qualify health-wise. I tell people, if you drove in front of a hospital, you're probably not going to qualify for long-term care. That's just how strict they are. Whereas short-term care is just the opposite. It is a lot easier to qualify for health-wise and is a lot more affordable. But the 11 health questions, the first one deals with the limited benefit. To get the very best plan, it's called Essential Care Plus. You must say no to all 11 questions. And they're very liberal. Like I said, they're not difficult. The next plan, the middle plan, is called Essential Care. You've got to be able to say no to the first 6 questions to get that. And then to get the limited benefit rider, you just have to say no to the very first question. But we have very generous household discounts. We give a 7% discount on if you have someone living with you that's over the age of 40. And we will double that if they both people that's in that household would apply and get issued, then it would be 14% on that total app, the total policy. And then we also have if they have multiple policies with Wellabe, like let's say one of them has a Medicare supplement, we will tack on an additional 5 on that policy as a discount. So you can get up to as much as 19% discount on the short-term care. But the reason why this is really popular, guys, like I said, it's less expensive, it's easier to get, and it's approved. You'll get it approved much easier and faster than a long-term care policy. To sum it up, short-term care is just a smaller version of long-term care, and it's less expensive and easier to qualify for. And you can offer skilled nursing care, and it's geared more for home health care. When cross-selling this, obviously anybody you talk to that's a Medicare Advantage, Med Supps, anybody, because skilled nursing care, skilled nursing facility care, they're going to have some coverage for that. But where their coverage really drops off is if they have to have long periods of time for home health care, or obviously if they have to go to a facility, they're not getting any help with that unless they're on Medicaid. But anyhow, like I said, the 3 plans got a very generous multi-policy discount. It has a limited benefit rider, like I said, for in most cases, like an uninsurable spouse or another person that lives with them, because we don't care what the relationship is between the two people living together. They could be siblings, they could be same sex, they could be just friends. We don't care. As long as 2 people are in the household, that's where they'll see the benefit of this, especially if both would apply and get issued. But we have lots of marketing materials, videos, postcards explaining this. Here's our current sales team. As you can see here, there's 5 of us. We do have a new member. The lady on the bottom right, her name is Dana Ewing. She's out of the Austin, Texas area. I've been knowing Dana for about 20 years. We worked together at 2 other organizations. But believe it or not, 4 out of these 5 people live in the state of Texas. I live in the Houston, Texas area. Mariana Jones, who is our boss, she lives near the Beaumont, Texas area. Jeremy Grantham just moved from Omaha, Nebraska, down to Lockhart, Texas, which is a suburb of Austin. But Courtney Mayer, she's been with the company longer than all of us. I think she's on her 16th year. She lives in Council Bluffs, Iowa, which is across the river from Omaha. And our home office is in Des Moines, Iowa. But as you can see here, we give you our email addresses. We give you our cell numbers where you can reach out. I'm your rep that helps you guide your team out the most. Feel free to reach out to me if I can assist you, but I would encourage you to use the agent self support first. Use that as your first option.
Real quick, there's a question in the chat. If somebody has had a stroke or a heart attack in the past,
Mhm.
are they able to qualify for the critical illness plan?
Yes, as long as it hadn't been in the last 5 years, or it depends on where they're at in that. For example, if they had a heart attack, but yet everything's going fine now, because we look back 5 years, so it depends on how long ago. But it's not necessarily an automatic decline, because let's say on the good side of that, let's say they had it, it was taken care of, no other things, they may be just doing checkups. We'll take a look at it. But I would just tell them to be just answer the questions on the application. But it should be fairly easy. We're seeing a high rate of our critical illness or our cancer, heart attack, stroke policies getting issued. Do you have any other questions popping up so far?
That was the only one.
To share your thoughts. We also, on the agent portal, and some of you probably even got emails about sharing your thoughts. We're doing an agent survey to help us, Wellabe, with communication. It started on March the 2nd, earlier Monday is when it started. And 5 responders, if you do the survey, there's going to be 5 responders that could win a $100 gift card just for giving us a survey. And but you can view the survey link, details, and rules in the agent portal. So please, 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 I beg you, go in there and do the little survey. It doesn't take but a minute. And like I said, you put your name in the hat for it's a $100 gift card. You can find us on Facebook. We have a private group on Wellabe on Facebook, and in order to join it, you have to you go through the Facebook to join. It's going to ask you 3 questions that you got to play by the rules, so stuff like that. But you'll be able to see all your peers in there. You'll be able to ask questions in there. You'll see a lot of articles and things like that. This is the agent self support phone number. This is what I would tell you to put in your cell phone for Wellabe or Medico. And the agent self support is 800-547-2401. And then you hit option 3. Typically, it'll go and you'll be speaking to a live person. But obviously, during AEP, we had a very overwhelming amount of business. We took in more business during 2025's AEP over that 7-week period than we took in the whole entire year of 2024. So that's just to show you how much business that we took in. So we had a lot of agents reaching out to us and saying, "Hey, well, I can't get through. I've been on hold for 30 minutes or whatever." So we to kind of help that, what we did is we added a message line to that. So if you're on hold and you're on hold for 2 minutes, a recording will come on and say, "If you'd like to leave your name and number, we will call you back as soon as we can." If you choose not to do that, then at 5 minutes, it's going to do it again. And it'll do it again at 10 minutes. If you choose to stay on hold, you're doing that at your own risk. I'm telling you right now, I'm telling all the people I deal with that if you can't sit on hold, then go ahead and do that. The average callback time is between 15 and 20 minutes. So I would just encourage you to do that. Now, you might call today and get right through, but I'm just saying, if they are experiencing longer than normal hold times, please use the callback feature. But you'll go through Agent Portal, obviously, to check on status of things or whatever. But like I said, if you're having trouble finding something or whatever, you can always reach out to me. I travel a lot and will be traveling starting next week a lot. But you can always call me, leave me a message, and I will get back with you in less than 24 hours. But if you have a burning question and you want to leave a email, this health sales team at wellabe.com, I would encourage you, if it's after hours, send your question or whatever it is that you need to know about to that email address. Courtney is the one that usually monitors that, and she does an outstanding job with that, by the way. And she replies back to everybody. Now, if she's got a lot of them to do, and if she knows, for example, if one of you guys did it, she might just click on your name, see who you're contracted with, and she says, "Oh, you guys are with NCC. I'm sending this question to Raymond," and she will. She'll send them to me, and then I'll get back with you. Now that I've covered that, I'm going to cover this Easy Match tool.
So Ray, while you get that set up,
Yeah.
sales material and brochures, can you order those through the website or do you just have to print
Yes.
them?
Yes. I'll show you here in a second, as a matter of fact.
Okay.
This when you log on to Wellabe as an agent, like your name will be showing up here, but you'll go to general forms. You just click right here on order supplies. You put the agent number, and I think this one's mine, and you hit mimic, or yours will look a little different than this, but you put it in there. But this let me know it's me. I can order, and virtually right here, it gives you every product and everything. It also says right here, browse catalog. You click on that, and it shows you pictures of every. You can come right here and choose whatever product you need to order on. You can do flyers, whatever it is that you want to do. For example, let's say you wanted to, I'm just going to do hospital indemnity. And then I'll put, well, see, it's only showing Texas. Why, guys? Because I'm only contracted in Texas. It's only going to show you the state that you're contracted in. But let's say if I want to do Texas, I click on that. And then it tells me here's the enhanced hospital indemnity agent flyer. Here's the hospital indemnity. This is brand new, by the way, and I'm going to email this to you, Courtney, and you can make sure everybody gets it. This is a brand new piece. It's our hospital indemnity insurance field guide. We just came out with this like in the last 3 weeks. But you can, I'll send it to you as an attachment, but you can go in here, guys, and you can download it and order it, whatever you want to do right there. Now, if you get snagged, or if you think you're doing it wrong, you can always call agent sales support, and they can help you with this to complete an order. And the great news about this is that all of this stuff, we'll send it to you. Well, any of our supplies, you can get it for the low price of free, and you can get it shipped to you for the low price of free. So there's no reason why you shouldn't order some of this stuff if need be. So I just wanted to show you where that is. So when you get back to the when your first page, this is what it opens up to. This is where you want to go to get to your quick quoting tool. Is right here under My Enroller. You just click on it, and it's going to say Launch My Enroller, which that's the actual digital application. And then this says Launch Quick Quote. I'm just choosing this just to make it easier for you. But first thing we're going to do is I'm going to put in here Tennessee. And then if you can help me again, tell me that zip code. What was that zip code? Is it this one? 37922?
Yes, sir. That's it.
Okay. And then I'm going to make it a male. I'm going to make them 65. So I'm going to put 10, 1, 19, 1960. All right. And then when you click update, as soon as you do that, it's only going to show you what's available in Tennessee. So this is very important that you get the state and the zip code right, especially if you're doing hospital indemnity because of the MA plans. So in this case, I'm going to click hospital indemnity. It's telling me that the next effective date is going to be 4/1. It's going to be bank draft monthly. First question to ask you, do you live in the same household with another person who is 18 or older? So if that's a yes answer, you click it. That's going to give them a 7% discount because that person lives with them. Then we click on My Easy Match. When you do that, it's going to ask you which county is that zip code in. And I think you told me it was Knox. Is that right? So right here is Knox County. And as soon as you put Knox in, it's thinking right here. Now it wants to know which company does this person have in Knox County. Okay, yes. So we click on Humana. And when you put in Humana, it's going to ask you just to the right, which plan do they have? Click on the HMO. When you do that, immediately, as soon as you did that, here's all the benefits on that Humana Honor Give Back plan. It tells me that they have a copayment of $335 with ambulance. They don't have any chiropractic services. They have an urgent care copay of $65. They have an inpatient hospital tier, $175 copayment for the first 5 days, zero after that. Chemotherapy, their out of pocket is 20%. Outpatient hospital copayment is 0 to $250. Outpatient rehab is $20 copay. And then the skilled nursing facility is a zero copay for the first 20 days, $218 after that. All right. So what this does is it shows you what that plan it does. And then just to the left over here, I didn't do anything. It virtually, the My Easy Match tool matched what our plan would be to cover that MA plan the best that it can be covered. For example, it's saying that you can we're going to offer them $175 on the daily because that's what they have. We're going to do a 6-day because their plan is for 5 days, so they're going to pick up an extra day there. So just the base plan with us is $11.27, and that's for these two benefits plus all the normal base benefits on our plan. Now, what riders is it's going to throw at you? It's going to give them our ambulance rider, which pays $250. We're going to give them a lump sum cancer of $2,500. But let's say this person says, well, is that all I can get? Say, no, you can get more. Now, here's the total price with all these riders that's already attached. Okay, it's $51.97 to make sure that all this stuff is covered. But let's say the person says, oh, I thought it would be more than that. Could I increase this cancer lump sum rider? Absolutely. You click this little down button, you do the max. The max is $10,000. As soon as I do that, boom, it jumped the price up to $71.77. Skilled nursing facility is going to pay $200 a day benefit. If they want less, you got three choices. You can do $150, $100, or $200. But it said $200, so I'm going to leave that. And then outpatient therapy and chiropractic services, because you remember over here, their plan doesn't have it. Well, we're going to give them the 30-day plan, and it costs $5.86. We also have an out-of-network indemnity benefit rider that if you want to add it, that we can do that as well. It's only $265, but you have a choice of, if you do that, we can pay $300 a day, $600 a day, or $900 a day. That's the enhanced rider that will take, if your customer is traveling outside of their network and have to go to the hospital, you know that their Medicare Advantage plan is not going to cover it, right? Or it'll be very, very little if they do. Well, with us, if you add this rider, $265 will get you $300 a day. And you can do 3 days. All right. $300 a day for 3 days is $344. But let's say they want more. I can do $900 a day out of network for 3 days if they're traveling and they're out away from their home network for $10, $10.32. All right. So now I'm up to 82. You got urgent care, right? We can pay some urgent care benefits on there. Lump sum hospital confinement. This right here, if you add it, it will pay. You have a choice of $250 all the way down to as much as $2,500. We'll give them $2,500 first day in the hospital. And this would pay in addition to whatever they get up here. Okay. So this is the rider that I recommend when you're doing a high deductible plan F or G. You can put this $2,500 on there and I'll take care of the out of pocket and do minimums everywhere else if you want. But that's just to show you how to navigate this thing. But it's only if you choose to do it. You don't have to. And then take it off. All you do is click on it where it's yellow. So I just click on that. And when it's not highlighted, that means it's not included. And then you got outpatient surgery indemnity rider. You can choose on this anywhere from $250 to $2,000. That'll cover outpatient surgery in addition to whatever else the plan pays. So I just wanted to show you that because whatever you come up with, whatever they like, we even have this is another great rider. We have an outpatient prescription drug rider, which is dynamite. As a matter of fact, any of all riders that you add to your plan, you're going to, like, let's say it's an existing plan they have and you put a new rider, you're going to have a 6-month pre-ex on any rider that's been added that they didn't have before. Okay. The only rider that you can add and there's no pre-existing condition clauses applying is the prescription drug benefit. So if I added a prescription drug benefit to a brand new hospital indemnity or one of the existing ones, okay, if I do that, they can start using the prescription drug benefit in the first 30 days of the plan. And the way it works is you have a choice of either a $300 limit or a $600 limit, and we pay all prescriptions at the rate of $20. So let's say they have a plan and they've got a zero copayment on generic drugs. Well, all we have to do is get a copy of that they filled the drug. Even though there's no price on it, we're going to pay you $20 for every drug that you send us. So if they have a generic drug that they paid $8 out of pocket, we're going to give them 20. If they've got a brand name drug that they feel that's $80, we're going to give them 20. And we're going to do that until they exhaust their $300 or $600 limit per year. And then it starts all over the next year. So it's a great little benefit. And the way I look at it, guys, I'm a numbers guy. So if I chose a $600 benefit, okay, it tells me it'll pay it's to pay for this rider, it costs me $30, right? So I do the math. All right, I know I'm going to get 600 back if I use it right. But if I spend roughly $30 a month, $30 a month over a year is what? $360. So I'm going to spend $360 to get 600. That's a good trade. I'll do that every day of the week. All right. So that's how you do that. And you can do the same thing with the 300. And, like I said, they may have prescription benefits. I'm just wanting to give them a little extra to maybe fill in other gaps, though. But if I do this one, it's only $14.91. Call it $15. $15 over a year is $180. They're going to spend $180 to get $300. That's a great trade-off. I'll do that every day of the week. But if you don't know, like I said, if you're a brand new agent, you don't know what they should get, always go by what My Easy Match puts out here at first. And it's going to mimic whatever this says that they have holes in. It'll automatically do it for you. And then whatever you select, you just go straight to the app and it transfers over. Very easy. Last but not least, I wanted to talk to you guys real quick about our Med Supp. Here's our current map. As you can see here, everywhere you see a darker brown, if you want to call that, that's where our Medicare supplement is available, and you can use it, the dental rider. We have an actual dental rider that you can add to a Med Supp, but it's only in the darker brown, it states there. The dental rider, it pays $150 if you add it. It's $17.50 to add it to a person. It's not based on age. It's just $17.50. But it'll pay $150 for the first year for dental services when they go to a dentist, and they can go to any dentist they want to. In the second year, if they have this rider, it'll pay $150 for 2 visits that year, or $300. And then if from the third year and beyond, it'll give them $450 to use going to the dentist. And we don't care what the services that they use. We're going to cut them a check. It's an indemnity, so they'll get a check for it. Now, if you live like in Texas, now Tennessee, you have that rider option if you want. Not only that, you get a 12% household discount, meaning if you ride a person in the state of Tennessee on Med Supp and they have someone living with them that's over the age of 50 or older, you can discount their premium by 12%. It is called the household discount. Okay. And you can do that for a husband and wife. So each one would get 12. All right. So, but if you live in a tan state, the dental rider is not available, but you can still write our standalone dental plan if you want to, or if they need dental. Okay. Some of the biggest things why, and this was really, really evident last year. Anybody that wrote our Medicare supplement and it was underwritten. Let's say you actually was going to be an underwritten. They were not necessarily an open enrollment. It weren't a guaranteed issue. Virtually, it's just going like a new person or whatever. If the health questions don't pop up on the application, it's because it is an accelerated underwritten application, and we have issued it by you just typing in their name, address, phone number, date of birth, social security number, or Medicare ID number. When you do that, that gives us the information we need to send it to our underwriting service that we use, and they can underwrite our Med Supp just off that information. And not only can they underwrite it, they'll do it in generally time of about 2 to 4 minutes. So if you wrote an app with us and the health questions didn't pop up, that means it's already issued. And it'll even pop up on the screen saying, congratulations, your policy's issued. We credit that to the way we're doing it. There's nobody else in the industry, to my knowledge, that's using this type of underwriting. And that's why ours is so popular. It's because, 8 out of 10 apps that you're doing that's underwritten, the health questions don't pop up. Now, is there an exception to the rule? Yes. Sometimes if you're writing it and, you're waiting to see if to go to the next page whether the health questions pop up, if the health questions do pop up, that means we have seen something in the background. Something's been flagged, but we can't adverse select people. So the health questions will then pop up because we want you to go ahead and ask the questions, because we want to see what it is that they think they have or don't have, because that's what we'll do it. So, and we're still issuing them then as well. It's just that sometimes, they might not remember that they had something done, but what's being flagged. So that's another thing. So we will ask for a little bit more information is what I'm saying. But typically our turnaround time on something like that is about 2 days. But you can you can go down, like I said, you saw where I got this under the product info. You can go down here and you can look for the highlight flyer, the flyer with dental, the New Jersey, it's all state. You can even get the outline of coverages and things like that. You can even get rates by saying see which product and rates right here. That's where you go for that. You could go for your re-rates right here under newsstand. Under your tools and training, guys, you can click on webinars and you can come through here and find, what's the next Tuesday talk and the topic. You can find when's your next training for short-term care, hospital indemnity, whatever. Any other questions? Hopefully this helps you.
Ray, I don't have anything else in the chat.
Okay.
We really do appreciate you taking the time out of your day to give us this overview, and we definitely have some interest in selling your products and hopefully a couple new contracts coming through. So thank you, Ray.
All you bet. Take care, guys. Thank y'all so much for having me, and good luck and happy selling.
We'll talk to you soon.